Hello everyone. Today we're going to be talking about the Affordable Care Act of 2010. Question is, what is the Affordable Care of 2010? The Affordable Care Act is a new mandated healthcare system that which will mandate that every single U.S. citizen must be enrolled in some type of healthcare coverage, whether it be sponsored employer insurance or your own individual insurance or Medicaid or Medicare or CHIP for children. Now, as we go along this little short summary, I'm going to be giving you a little bit history of what is the Affordable Care Act. Now, one of the things as we know today is healthcare will be changing come 2014. Healthcare as we know it today will not actually exist because there will be a lot of things that will be mandated of you as an individual that you will need to follow. Now, one of the good things about the Affordable Care Act is that it does create cheaper healthcare. One of the things that it helps a lot of people, a lot of things that it will be helping people with is one, is cost sharing. What is cost sharing? One of the things that the Affordable Care Act does is that preventative care will be covered at 100%. You will no longer be mandated to pay a co-insurance or to pay cost sharing, which is a good thing. That saves Americans a lot of money, and I think that's one of the best parts of the law. Now, people have lots of questions about when does enrollment start and when must I enroll into the Affordable Care Act. Open enrollment will be starting October 1st. Now, where do I go to get more information about the Affordable Care Act and where I can enroll? You will need to go to healthcare.gov. Again, it's www.healthcare.gov. That is the official website of the U.S. government where you will be able to obtain more information about the Affordable Care Act. Now, one of the things that the Affordable Care Act does, and I'm going to go a little bit into the initial open enrollment and how to process through the open enrollment piece of it. The initial open enrollment period will start October 1st through March 31st of 2014. On or before December 15th of 2014, you must be enrolled into some type of healthcare coverage to start on January 1st. Okay, so what does this do? The marketplace initial open enrollment starts again October 1st of 2013 and it ends March 31st of 2014. Annual open enrollment periods after that start October 15th and ends December 7th. So special enrollment periods available in certain circumstances during the year. Only if you have special circumstances. Then the federal government will allow you to go through certain periods of your open enrollment. Now, there is a couple of levels of coverage. There are 4 levels. Those levels are the bronze, silver, gold, and platinum. What are those? What are those levels? Okay, so give you a good example of one. One is called the bronze level. The bronze level pays up to 60% and 40% is your responsibility. The silver, the insurance plan will pay up to 70 and you are responsible for 30. The gold plan, the insurance company will pay up to 80% and you would be responsible for 20%. Essentially, that's kind of what a lot of people right now have through their employer sponsored plans. The best plan, and I guess would be one that would be a little bit more costly, would be the platinum plan. The platinum plan, the healthcare insurance would be paying up to 90%, and the enrollee would be responsible for the 10% of cost after them. There is 10 essential items that will be covered under under the new federal guidelines. Those 10 categories that insurance companies are mandated to cover are ambulatory patient services, emergency services, hospitalization, maternity and newborn coverage, mental health and substance abuse, prescription drugs, rehab services, laboratory services, preventative and wellness services with chronic disease management. This is something that no healthcare insurance has ever covered. As of now, it's still not being covered. Well, yes, it is being covered because that became something that was covered back in 2011 as the Affordable Care Act provisions started kicking in. So now, one of the most important parts of the Affordable Care Act is the pediatric services, because now the pediatric services will also cover oral and vision care services. Right now, that is not something that is being covered by your insurance for those that do have insurance. So now this will be something that will be covered for children that will be able to have this types of services under your regular health plan. Now, one of the most important things that we must recognize about the Affordable Care Act is that there will be penalties that you will be assessed if you do not enroll. Number one is that the IRS will be issuing out these penalties. What are those penalties? We really don't know yet. The government, well, DHS, which is the Department of Health and Human Services, will start putting out more information about how those penalties are going to look like and what those penalties will be. So later on, you'll be able to have more of that information. But there will be penalties if you so choose not to have health insurance. That will be something that you will be assessed. Now, here in the state of Texas, our governor has elected not to expand the Medicaid program. What the Medicaid program would have done, if it would have been expanded, this would have allowed healthcare coverage for everyone. Right now, really how the Medicaid program works in the state of Texas is the people that are eligible for Medicaid are your disabled and elderly or women, infants, and children. Right now, your average adult male doesn't qualify for Medicaid. The only time that the adult male would qualify for Medicaid would be under the SSI program, which is the disability program. So right now, pretty much your only options would be is to enroll in one of the federal mandated insurance programs, which will be called an exchange. So with that said, if you would like to have more information about the new Affordable Care Act, please by all means go to www.healthcare.gov. I'm sorry again, it's www.healthcare.gov. Again, that website is www.healthcare.gov. And thank you so much, and you guys have a wonderful afternoon. Thank you for your attention, and again, if you have any questions regarding the new affordable health care and the new insurance law, by all means, there are some other sources that you might be able to go to, which is the CMS website, which is the Centers for Medicare and Medicaid. And again, the www.healthcare.gov has been a very, very good source for information. Again, thank you so much. Bye-bye.